Now is 9:05, and so we will go ahead and get started. So thank you all for introducing yourselves. You can continue to do so into the chat. Good morning and welcome. We are so grateful to have our partners from Solid Ground Benefits Legal Assistance here to provide their expertise for this training. We are here for the next 2 hours, but I want to go over a few logistical things and also take a moment before we get into more of a proper introduction of our partners and get things started to talk with you all. Like I said earlier, ground us in this moment as we're under the threat of losing these very vital benefits and get more into who we are as a coalition of member organizations. So for introductions, my name is Kevin Lee. I use they, he pronouns. I am the Senior Programs Manager here at the Coalition. I am joined by Danielle Palmer-Friedman, our Communications Lead, who is here to help with support for the attendees and to help with chat and the questions portion of this meeting. At the end of this training, we will be joined by Hallie Willis, our Community Policy Manager, for a few minutes for us to do some advocacy and action. So for now, let's take a moment and talk about why the Coalition on Homelessness is bringing folks together for this kind of training in general, but also because right now we are in a fight to maintain the existence of these benefits. So I'll start with our coalition mission, vision, and values. Our mission is to mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Our vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home. And our values are equity, justice, and collective action. And so about that collective action, today, we're not only interested in making sure service providers and people in general have great information, but we do need to stand up with the people who rely on these programs. And as a coalition of service providers, you all are the experts on the barriers of getting out of poverty. And so it's very important that your voices are being heard. So again, as a coalition, we have to utilize these times that we're together to meet the very real threat hanging over the people who rely on public benefits for survival. The cuts to these programs that are being considered at the federal level right now are a clear attempt to gut the agencies who administer the programs and make life and survival harder for the people who access the life-saving benefits. So with that, and again, at the end, we will be joined by Hallie Willis, our community policy manager, and we will take some time at the end for advocacy and collective action. But without further ado, I said I would keep it brief. We are again so excited and grateful to have our partners from Solid Ground Benefits Legal Assistance to provide their expertise on Medicare and Medicaid for this training. So at this time, I'd like to introduce our presenters, Janelle Stark and Tanner Yamada. Janelle, if you're ready, go ahead and take it away.
Yes, thanks, Kevin. Can everyone see my screen? Okay, great. My name is Janelle Stark. I use she, her pronouns, and I coordinate intakes for the BLA program at Solid Ground. Okay, before we get going, I did want to start with a land acknowledgement. Solid Ground operates on land that has always belonged to the Coast Salish and Duwamish peoples. As a modern nonprofit, we are part of a colonialist system that stole their land, attempted genocide, and continues to oppress Indigenous peoples. And you can read our full land acknowledgement at the website on this slide. And I believe that we will be sending out slides after the training. Also, like most modern day US institutions, Solid Ground benefits from the unaddressed legacy of stolen labor at the foundation of this nation and its vast and inequitable wealth. And you can also find our labor acknowledgement on our website as well. And lastly, before we begin, we did want to touch on the fact that public benefits laws and policies are steeped in systemic racism. It's particularly true of the work requirement policies that are woven through TANF and food and Now there's been talk of them being implemented in Medicaid as well. And I'm not going to go into that too much. It's not the purpose of this training, but you can learn more by reading any of the articles that we included. So what are we going to cover? We're going to go through a lot today. It is pretty dense. Don't worry. We'll take any questions via email afterwards. So if we don't get to you or there's a scenario that you aren't sure how this information applies, we're going to provide our email. We're going to go through Magi Medicaid, which is the income-based Medicaid in Washington State, Classic Medicaid, everyone's favorite, which is Spend Down. It's very confusing. We're also going to touch on Medicare. Our agency doesn't typically deal with Medicare, but we're going to review it in the context that it intersects with Medicaid and Medicare savings plans. We're going to discuss common issues, how to avoid them, and what do you do if it goes wrong? How do you appeal? And here's some helpful definitions, things we'll discuss. A lot of them you may already know. I'm not going to read them to you, but they're going to be in the slide deck. So we're going to take a few seconds to just look at these before we move on. They'll be helpful as we go through this presentation. All right, Magi Medicaid. So Magi stands for Modified Adjusted Gross Income, or Adjusted Gross Income, which you may be familiar from your tax returns. So there's that, and then there's Classic Medicaid, which is Medicaid for people who are aged, blind, and disabled. This is typically what people who are on ABD or SSI would be receiving. And they're both administered in Washington State. They'll be called Apple Health, but that is Medicaid. And so who can get covered under Magi Medicaid? So you need to be an adult between 19 to 64, a US citizen or eligible immigration status, live in Washington, not be on Medicare. There is a specific program for parents and caretakers that meet certain income requirements. Those are in Family Planning Services program, and those are below 138% of the federal poverty level. Now, Medicaid income limits for children and pregnant persons are significantly higher, as you'll see on the next slide. Now, these income limits are updated annually based on the federal poverty level, which I believe gets renewed every April. So these are the current amounts. As you can see, the Apple Health for Kids has a significantly higher limit, as does the Apple Health for pregnant persons. So what types of income are counted? There's certain income that will count and will not count towards Medicaid. What will count? We have wages, taxable interest, dividends, unemployment benefits, pensions, IRA distributions, spousal support, income from self-employment, state income tax refunds. Now, you might think that one may not apply because we don't have a state income tax in Washington, but this can be applicable if someone moves into Washington and receives an income tax refund from their prior state that they were living in. Also, rental income and Social Security benefits. And types of income that are not counted. That'd be VA benefits, child support, certain scholarships, Native American tribal income, and gift or inheritance money. And there's also this website you can go to see if your client is income eligible or not on HCA on their website. And yes, some deductions are allowed. And you can see these here: spousal support paid, certain moving expenses, student loan interest, self-employment health insurance contributions, self-employment tax, IRA deductions, and money contributed to a flex spending plan. And this is exciting. There is no resource or asset limits, so a person can have any amount of money in their bank account. It's based on their income, not their resources, for their eligibility for Magi Medicaid. And that's determined over a 12-month period. And I am seeing some questions in the chat, and we will take a break for questions in a little bit. I just want to acknowledge that I am seeing those. So how does one apply? There's many ways you can apply now. We have the website. Of course, everything has an app nowadays. We have an app. And you can also call, you can mail or fax, or you can go through a health plan navigator. And we have that information on this slide. And when you applied, you'll need verification of your household monthly income, your immigration information, if that applies to you, dates of birth for your household, and social security numbers for the household members. There are some exceptions for domestic violence survivors, and they're not always required to provide their social security number. So unlike other health insurance, like the exchange, where there's an open enrollment period, or some of the Medicare plans have an open enrollment period, you can apply or switch plans for Apple Health any time of the year. Sorry, I'm quite done with that slide. And as often as every month. Reporting changes, this is something that gets people tripped up in general DSHS benefits, not just specific to Medicaid. When in doubt, report the change. You should report them immediately if you or someone in your household has a change in their income. It's more than $150 over 2 months, moves, gets pregnant or has pregnancy needs, married or divorced, gives birth or adopts a child. If they go into a facility or jail or prison, this is something that can affect a lot of benefits. If someone's in an institution, there are different things and that they're eligible for based on whether or not they're living independently or in an institution. So it's something to keep in mind with all benefits. Any change in their immigration or citizenship status, change in healthcare coverage, if they got healthcare coverage through their job, and any changes in tax filing situation. And those changes can be reported at the WA Health Plan Finder website or by calling the number that's on the screen. So Washington Medicaid members in Apple Health are enrolled in a managed care plan or an MCO. That means they have a set network of doctors to choose from, similarly to private insurance, where you'll have in-network providers with your insurance. The plans are not all available in every area, although most of them are available in Western Washington. I think there's only one that is not. And the kind of neat thing is there are some extras with these MCOs that not everybody knows about. And I think I'll talk about that more on the next slide. Also, things like cell phones, membership to Boys and Girls Club, GED testing, electric breast pumps, acupuncture. And these are some of the new ones that I learned about preparing this presentation. Free Costco membership and car seats were two things that I didn't know about that you could get through certain MCOs. And there's a link on this slide here that connects to a pretty useful chart that goes over all the extra benefits for all the plans, which can be useful in helping a family or individual client determine what would be best for them. And here's the contact information for all the MCOs. All right. And we're going to take a break for questions. Kevin, if you're able to pick a few questions for the chat for me that may not have been answered already.
Yeah, I think at this point we have just two questions and they have been answered or they've been addressed in the chat. I haven't been able to read it, but Patricia um, has answered some or has addressed them. But I want to read the questions just so they make it onto the recording and also just to draw attention in case that resonates with anybody in the audience or in anybody here today. So the first question is, if they are married, does their spouse's income count? And then the second question, what about undocumented clients or those who are in the process of applying for asylum or a T visa? So again, there's those questions have been touched on. Janelle, If you have anything to add to those, you can now.
I don't have anything to add. Patty is the attorney and probably has a better answer than I would on those questions, so I will defer to how she responded. But thank you for reading those aloud,
Of
Kevin, so
course.
we
And
we have
actually, let
them
me just go
on
ahead and read
recording.
the response here
Yeah.
again, so that makes it onto the recording and just and for people listening along. So as far as spouse's income, yes, the total household income is used to calculate income eligibility. But because it's based on FPL, it also accounts for the number of people living within the household. So if the household income limit is higher, so the household income limit is higher for the household of two rather than the household of one, for example. So that functions pretty similarly to, SNAP or other types of benefits as well. They're going to look at number of people in the house, but that also means that the amount you can have is more. The second question about for undocumented clients who are in the process of asylum or applying for asylum or T visa, there are a lot of programs with individual program requirements for documented immigrants. We have a separate side deck slash training specifically for documented immigrant benefits. So we're happy to share those with you, scheduled to do a presentation on exactly that for to your program if you're interested. And so again, that response is from Benefits Legal Assistance. So if that question is and response is relevant to you, please reach out. And then one last question that just came in a minute ago. How do Medicare recipients apply for supplemental Medicaid for blind or older people? Is there an additional benefit?
Yeah, we'll talk about that in the next section of the presentation, which gets to the intersection of Medicare and Medicaid. So Tanner will be covering that. And if that question isn't answered via that section, feel free to say something again in the chat, and we'll make sure that you get the information that you need.
Okay. And so we do have just got a couple more in, but I'm wondering if we can move forward with the training, and then we can take a look at those at our next question stop. Or
Sure, that sounds good.
All right, I think I'm up. So hi, everybody. My name's Tanner Yamada. I'm an attorney, benefits attorney here at Solid Ground. Thanks so much for having us. Really appreciate the opportunity to talk to you guys. Talk to you a little bit about Medicaid and what we do here at Solid Ground. So I want to transition from talking about Magi or Apple Health to classic Medicaid. That's kind of an umbrella term for a number of different Medicaid programs that provide coverage to individuals who are aged, blind, or disabled. Someone might be eligible for a classic Medicaid program if they're 65 years of age or older, disabled, blind, receiving Medicaid with a spend down, receiving SSI, or receiving Medicaid through the Workers with Disabilities program, which is sometimes shortened to the HWD program. So generally, classic Medicaid, umbrella term for a lot of different programs that aren't only income-based, but also designed to provide coverage to people with disabilities or who are aged. Go next. Awesome. Okay. So the first program we'll talk about is the Categorically Needy program. This is a classic Medicaid program that individuals are automatically eligible for if they're receiving SSI benefits from the Social Security Administration. Because eligibility for this program is based on eligibility for SSI, the same income and resources, those limits that would apply to the SSI program also apply to the CN program. Okay, next up, we're talking about the Categorically Needy SSI related program, which I think they should have a better name for because it sounds so similar to the Categorically Needy program, but it is different. Really, the big difference is that in this program, the person doesn't have to actually be receiving SSI to qualify for coverage. They need to meet the SSI income and resource requirements. And they also need to prove to the Department of DSHS that they meet Social Security's definition of blind or disabled, but they don't necessarily need to have that determination from the Social Security Administration yet. So this is the coverage for most people who are on ABD or who are waiting on a pending SSI claim. This is a really important program because sometimes SSI claims can take years before they're decided on. So this program allows people to receive categorically needy coverage while that claim's pending. Here are the income and resource limits that apply to the categorically needy SSI related program. The income limits change yearly. It's the same, the income threshold is the same amount of the standard SSI monthly payment. And so because that gets adjusted every year, the income limit gets adjusted every year. This year, it's $967 for a single person household and $1,450 for a two-person household. There's also the resource limit. That is the same as the SSI resource limit, which is $2,000 for a one-person household and $3,000 for a household of two or more people. And again, the income and resource limit is always going to match the SSI income and resource limit, again, because the program is designed for people who are financially eligible for SSI, but might still be waiting on the disability determination. So how can someone apply for categorically needy coverage? A lot of different ways. Obviously, if you need to apply for SSI, that application goes through the Social Security Administration. A lot of ways you can get that done. Oftentimes, it's easiest to contact your local office. If you're not sure where your local office is, you can use the link right here on this slide to find it. And to apply for ABD and categorically needy coverage, Medicaid coverage, that goes through DSHS. That application can be submitted online at their website, over the phone at the number listed on this slide, or in person just by going to the nearest community service office. Questions on the categorically needy program?
I don't know if we have questions specifically on the categorically needy program, but we did have some more questions coming in. And so, a lot of them have been addressed. So if folks don't have the chat open yet, please check that out because again, some of these questions that may not specifically pertain to your client may actually be connected to, or a situation like that might come up later. And so, as you know, it's always great to have more information. One of the questions was about student loans being counted as income. Again, going back to the last section, and the answer is that is not counted. It is a loan. I should actually read out the response and not synopsize that. And then okay, here we go. Yes, because it's a loan rather than direct income, they're not counted. Payment of interest on those loans later are considered income deductions as well. The next question we have was about, oh yes, we have put a link to our YouTube page for those who want to follow and subscribe, but also have access to our past trainings and a lot of the trainings offered by Benefits Legal Assistance. It looks like there's just one series of trainings that hasn't made it into recording yet. That's the immigrant benefits training. And so looks like that is soon or to come in the future. There was a question about a client not having filled a review for their Medicaid before. And so again, it looks like there's just a lot of reasons why individuals can apply for Medicaid outside of their enrollment period. It's always worth reviewing the reasons with the client to see if any of them apply and can be used to assist them. Okay, a few new questions. How do Medicare recipients apply for supplemental Medicaid for blind and older people? Is there an additional benefit? And it looks like we will be addressing that later in the presentation. And then one last question that hasn't been touched on is about ABD. I thought ABD had an asset limit of 6,000. Is that incorrect?
No, I'm struggling off the top of my head to remember what the asset limit is. I do, yeah, exactly. Patty just answered, I think it was increased to 12,000, which is great. I think the root of that question might be, and I could be incorrect here, my reference to the SSI resource limit. So it is important to bear in mind that the ABD program's resource limit and the SSI program's resource limit is different. The ABD limit is $12,000 now, but the SSI limit is still $2,000 for an individual or $3,000 for a household of 2 or more, which can cause issues with ABD applicants here in the state who might be eligible for ABD if they have resources of, say, $5,000, but are actually ineligible for SSI. So that's a little bit beyond the scope of this presentation, but to answer the question itself, it is $12,000, not $6,000.
Nevertheless, if that's a new update, that's really great information for people to have. And again, just to know that it's not a bad question, right? Some of these details can change. And so, okay, thank you all so much. Again, we're still going to be taking time to answer questions. So please put them into the chat. And Tanner, if you want to proceed.
Definitely. Okay, so this is the real meat of the presentation here. This is probably the most complicated part and a part that a lot of people we talk to have questions about. So we're going to move on to talk about what's called the medically needy program, which is another type of classic Medicaid. The medically needy program provides Medicaid healthcare for certain people with income above the categorically needy income limit, but resources below the medically needy resource standard. So I'll flesh that out in the following slides. Many people who receive coverage through this program do so through what's called a spend down. That's a term you might have heard before. And we're going to discuss what a spend down is and how clients can meet it, and also how it's calculated in the following slides. So to start off, who's eligible for the MN program or the medically needy program? Generally speaking, to be eligible, someone needs to be blind, aged, or disabled. They need to have income that's too high to be eligible for CN Medicaid coverage, and they need to have significant out-of-pocket medical expenses. The medical expenses are key to this program because the program allows people to deduct or spend down, that's where the word comes from, those out-of-pocket expenses in order to bring their income into the program's eligibility limits. Yeah, next slide. So how does that really work? If someone's eligible for the MN program, they can get Medicaid once they incur a certain amount of medical expenses during a specific period. This is called a spend down. So someone's spend down amount is calculated by determining what their excess income is. And someone's excess income is just the amount of income they receive that exceeds the SSI payment standard. This year, the payment standard is $967. So for instance, I mean, let's go back to the last slide. Yeah. So for instance, let's say you earn $1,000 a month. Because the SSI payment standard is $967, your excess income would be $33. Obviously, in reality, it's generally going to be higher than that. And again, we have more examples following. But it's important understanding how the spend down is calculated to understand what excess income is, how it's calculated. And it's pretty simple. It's just the amount, dollar for dollar, essentially the amount you're over the SSI standard. And again, there's also a resource requirement, which is the same as the SSI resource requirement, $2,000 for an individual, $3,000 for a household of 2 or more. Yeah, so someone who's eligible for medically needy coverage with a spend down selects a base period, and that's what determines the total amount of medical expenses that they'll need to incur before their Medicaid coverage activates. The spend down amount is calculated by multiplying someone's excess income by the number of months in their base period. So here's an easy example, and we're gonna have a more complicated example that follows. But the more straightforward one is if someone were to have $40 in excess income and choose a 3-month base period, then their total spend down amount would be $120. In this person's situation, their Medicaid coverage would start after they incurred $120 in medical expenses, and the coverage would continue until the end of the base period. Now, that person would still be responsible for the $120 themselves. Whether or not that $120 is actually paid or not isn't really important. What's important is that it was incurred. But beyond that $120, Medicaid will trigger and provide them coverage for the remainder of their base period, regardless of, or depending on how long that is. Okay, so here we go. Time for some math at 9:35 in the morning. Yeah, this one's a bit more complicated, but it's much more realistic to what you see in the real world. Oftentimes people who are on MN spend downs are receiving income through SSDI or Social Security Disability. So we're going to talk about our hypothetical friend Sam, and Sam receives $1,200 a month in Social Security Disability. So first, what happens is there's a $20 deduction for unearned income generally. So the countable income goes from $1,200 to $1,180. After that, Sam gets to subtract $964 for non-medical expenses from the countable income of $1,180. Again, that figure changes annually, and that's because it matches the maximum SSI payment standard. That's the amount of money the federal government says is enough for people to cover their out-of-pocket medical expenses. Obviously, that's not the reality of the situation, but that's why it's set to that amount. So after we subtract the $964 from the countable income of $1,180, we arrive at the excess income of $213. Okay, so now we have excess income. We're almost done. And now we just need to multiply that figure by Sam's base period. And again, the base period can be anywhere between 3 to 6 months. The client or the applicant gets to choose what their base period is. So here, if Sam selects a 3-month base period, then we just multiply 213 by 3 to arrive at the total spend down amount for Sam of $639. So ultimately, in this scenario, which we'll distribute these slides and it might be easier to kind of read through this on your own time. But in this situation, Sam, once they incurred $639 within the 3-month base period, Medicaid would activate and then provide coverage for however long in that period remains after they incur that expense. Okay, yeah, and one more note on that is that, like I said earlier, the spend down and eligibility periods, they can range between 3 and 6 months. So if a recipient has a 6-month spend down period from January to June, Medicaid will provide coverage once they meet their spend down amount and continue to provide coverage through the end of June. However, once July begins, they're going to be in a new spend down period, and they're going to have to re-incur that same spend down figure before Medicaid continues to provide coverage. Some tips to remember. I think I mentioned this just a second ago. But medical bills counting towards the spend down don't actually have to be paid. They just have to be incurred. Medicaid isn't going to pay for the cost of the spend down, but the client doesn't necessarily have to either before the coverage activates or anything beyond that. Another thing that we see sometimes is that medical expenses that third parties are liable for don't count towards a spend down either. Example we see sometimes is medical bills that auto insurance companies are liable for. If that's the situation, then you can't use that that amount to count towards your spend down if someone else is liable to pay for it. And then the last thing is that expenses that count towards spend down need to be prescribed. So that can be frustrating. Sometimes people have large out-of-pocket expenses for health things that they need, but might not be prescribed by a physician. And in those situations, oftentimes the department refuses to count that towards the spend down amount. Finally, it's really important that for clients who are on spend downs to keep really good track of their medical documentation and to make sure they're submitting that to the department. The department doesn't keep track of anything by themselves. They expect the clients to do that for them. And so, information about costs that are incurred can be provided by fax or in person. But regardless of how somebody wants to do it, it's important they write some sort of identifying information on what they submit, whether that's their client ID or their SSN, just so that once the department receives it, they know whose bill that is and where to apply it. How to apply for medically needy coverage. You do this the same way you would applying for categorically needy. If you needed to do that, you can do it online at that link here. You can do it by calling the customer service line, or you can do it by visiting in person. There isn't an income limit for medically needy coverage, but the higher your income is, the higher your spend down amount's going to be. And oftentimes, if your income's high enough, your spend down is going to be so high that you're just not going to be able to meet it within a 3 months or 6 month base period. Oh, and I think I'm going to throw it back to Janelle for the next 2 slides.
Yes, thanks, Tanner. Okay, so how to complete a renewal. Sorry, I thought we were going to the question slide next. I was a little thrown off. Yeah, you can do that at WashingtonHealthPlanFinder.org. You can also call. And for classic Medicaid, you can do it through WashingtonConnection.org or by calling DSHS or going in person to DSHS. And what do you do if you missed a deadline? So if a client misses a renewal deadline, but they still complete the renewal within 90 days, their coverage will be able to continue from the date they lost it with no gap. So that's helpful. So if someone thinks that they lost their coverage, they may not be out of luck yet. You may be able to help them still complete that renewal. And if you don't qualify for Apple Health, you may still qualify for other coverage through a qualified health plan. Those are the health plans on the marketplace, the healthcare exchange. So you might be able to see if they qualify for one of those plans. And completing the renewal will help you see if you qualify for one of those plans. So if they put in their information on the Health Plan Finder website and it says you're over income, it should still show them what qualified health plans they might qualify for. Now we're on to questions.
Okay, so we did have a few questions during that section, and some of them were already addressed, but we just got a few new ones. So maybe I will take, we'll just kind of go over some of the ones that were addressed. How is income verified on those programs for folks that get paid cash? Is it from different sources like yard workers, outside Home Depot, construction workers, etc.? And so the answer to that is usually cash income is hard to verify. Most of this is based on self-reporting and their prior year's reported taxable income. They can also ask for bank statements and ask questions about large cash deposits. And yes, they also asked if slides would be shared. So again, slides will be shared and recording of this on the Coalition Home YouTube page. Another question was seeming maybe a client-specific question, but they have a refugee client who came with a lottery green card program, wants to know if they can apply for Medicaid. And the response is don't know for sure without knowing more details, but usually refugees are considered qualified immigrants or qualified aliens, QA in the statute, and are eligible and are able to access Medicaid. So however, there's usually a 5-year waiting period before they are able to access it. In the interim, they may be eligible for other programs like AEM, which is Alien Emergency Medical. And then a few questions in the chat that have not been addressed yet. So if our presenters want to or can, we can. So the first one, so what is the CN limit versus the MN limit? CM limit with 967 in parentheses.
Yeah, that's a really great question. It kind of gets to the heart of the difference between these two programs. The CN limit is 967 this year. It would increase next year because SSI is going to increase, but this year it's 967 because that's the full SSI grant is that amount. And then the medically needy limit's different. Well, technically it's the same. The income threshold to receive coverage from the MN program is also $967, but the MN program allows you to spend down your excess income. So you need, if you have $1,200, you're going to need to spend down your money to get to 967. But once you get there, you're good to go.
Thank you, Tanner. A couple more questions here. If someone doesn't have a phone or email by which they can, by which we can help them apply for Medicaid. Also, oh, in situations if someone doesn't have a phone or email, is there support for them? So again, about accessibility, is there support or in those situations for no phone or email that you know of?
Yeah, it's certainly not easy. The department should definitely do a better job about making these services accessible, and it's kind of hit or miss in that front. I would say in this situation, they could go in person is always an option if that's something they can do, obviously. They do all notices and documents are also sent through the mail. So long as you have a stable mailing address, you should be receiving all the notices you need. So that's a way that without a phone or email, you can still stay plugged in with the department. But it is harder without a phone or email or stuff like that. But there still is the option of going physically into a CSO and doing things through snail mail as well.
Thank you, Tanner. And then one last question um, about married. If you're married and satisfy spend down based on marriage, are both parties eligible for MN?
You know, I'm not 100% sure, but I'm like 95% sure yes. But there's kind of a trick to that, which is just kind of unfair, I guess, or the program isn't designed very well in this regard. Because like we just said, in order to get MN coverage, you need to spend down to 690 or $967, right? But that's the same whether you're applying as a single individual or a married couple, which doesn't make a lot of sense because a married couple's SSI rate would be higher than the $967. But for whatever reason, that's just the way the programs work. So you can get coverage for both a husband and a wife or whatever two parties through a medically needy spend down, but you have to spend it down all the way to $967 the same way you would as if it was just one person doing the spend down.
Thank you again, Tanner. And so, yeah, with that, let's go ahead and continue with our presentation. I'm glad that we've had enough time to check in with everyone. But yes, in case people have questions and we don't get to them, we will have an opportunity to make sure you have everyone's contact information. You can send questions out afterwards. So let's go ahead and move on.
All right, I'm going to keep going here. I think like Janelle referenced before, we're going to talk about Medicare a little bit, but bear in mind Solid Ground and BLA doesn't do a lot of work with Medicare cases directly, but it does intersect with some other state benefits that come into play with regards to covering some of the costs of Medicare. And so we just wanted to give you some general information about Medicare and also the contact information of where to reach out if you have clients who are experiencing Medicare issues. One important difference to note between Medicare and Medicaid is that Medicare is a federal health insurance program, whereas Medicaid is a state-run based program. Excuse me. Individuals can qualify for Medicare for a lot of different reasons. If they're 65 years or older, if they've worked under the Social Security or Railroad retirement systems. Certain young people apply or qualify for Medicare if they have a disability, or in some situations if they have a disabled parent, and as well as meeting citizenship and immigration requirements as well. One major thing to note about Medicare and why we're talking about it today is that unlike Medicaid, Medicare has a lot of premiums that are associated with it that get passed along to the beneficiary. Medicaid's great because those premiums and copays are all paid for by the state, but when you get into the federal system and you start receiving Medicare, that isn't the case. So what are the different types of Medicare? You've probably heard about these. For me, I heard about them all my life, but I never knew what they meant. So maybe this is just helpful for anyone out there who's like me. Part A, Medicare Part A is hospital insurance, covers things like hospital stays, care in skilled nursing facilities, hospice care, and some home health care services. Part B covers certain doctor services, outpatient care, medical supplies, and preventative services. Part C is optional, and it's called Medicare Advantage. Essentially, Part C is a managed care plan that Medicare recipients can opt into for an additional cost, and they receive coverage beyond the standard Part A and Part B coverage. Finally, Part D is prescription drug coverage that helps cover the cost of certain prescription medications. Yeah, okay, and Medicare premium. So most people don't have premiums for Medicare Part A. The standard Part B premium is $185 this year. Again, that number I think changes annually. And that $185 is kind of the standard amount, the premium amount, but it can be higher based on someone's income. The Part C plans have I mean, there's a lot of different Part C plans, so you can compare costs, and you can do that on the Medicare saving or the Medicare.gov, which we've linked here. And Part D monthly premiums can also vary by the plan and can also vary based on the income of the recipient. Okay. And so, like I said, we at Solid Ground don't handle a lot of Medicare cases, but I wanted to plug the SHIBA program for you guys. SHIBA stands for Statewide Health Insurance Benefits Advisors. Washington State SHIBA provides free, unbiased, confidential help for Medicare, with Medicare, to people of all ages and backgrounds. SHIBA volunteer advisors can help in a variety of different ways. They can assess a client's healthcare coverage needs. They can help determine eligibility, assist with enrollment, and a lot of other things. So they're a great resource. If you have anybody who has questions or needs assistance with the Medicare, I highly recommend you reach out to these folks. We're going to distribute these slides, like I said, but it's pretty small, but we do have their phone number and their website on the right hand of this slide. Okay, cool. So now we can talk about Medicare savings programs. So like I was saying before, Medicare comes with a lot of premium costs, which is really bad for clients. They can be kind of burdensome. $180 is not a small amount. So because if you're on Medicare, for this reason, you might qualify for extra help from the state to offset some of those premiums, deductibles, and co-payments that you might experience if you just receive Medicare itself. There's 4 different programs that can help. They're all called Medicare Savings Programs, which are just often shortened to MSPs. Just one thing to keep in mind that can sometimes cause confusion is that MSPs aren't medical insurance themselves. If you're to be approved for MSP, you're not getting your healthcare coverage from Medicaid. You're simply getting Medicaid to reimburse some of the care or to cost share some of the care that you're receiving through Medicare. And so to be eligible for a Medicare savings program, you need to be receiving Medicare. You need to be a Washington State resident. One way is if you're 65 years or older, or you could also be a younger person with a disability. But regardless, you're going to have to meet the MSP program's income standard. Again, the chart here to the right shows the 4 different MSPs and the income limits for a 1-person and 2-person household. You'll notice that those figures are set in accordance to a percentage of the federal poverty level. So again, every year the federal poverty level will change. So the income limits will increase based on that level going up as well. So 4 different types of MSPs. The best one is the Qualified Medicare Beneficiary Program, or QMB. This is the one that does the most. It pays for Part A and Part B premiums, pays all deductible, and pays co-payments, except in the case of prescriptions. Another one is the Specified Low Income Medicare Beneficiary. That's SLMB. That one just pays Part B premiums. Qualified Individual is QI1. That also pays Part B premiums. And then the final program, this is kind of a niche program, but it only applies in certain situations, but it's the Qualified Disabled Working Individual, or QDWI, and this one only pays Part A premiums. Again, can we go back to the slide one before this? So again, you'll see like the QMB, you have to have the lowest income possible of these four programs, but it covers the most, right? And so that it kind of it's intuitive that way, where the lower your income is, the more the MSP that you qualify for is going to cost share. Thankfully, there are no resource limits for the MSP programs. That's a really great development. Um, that was a change that happened all the way back in January 2023, but we keep it on the slide because we like to celebrate wins whenever we get them. So this is a great development. No resource limits for the MSP programs. Yeah, and then just to speak on a few issues that we see with people who are on QMB. Federal law actually forbids Medicare providers from billing people who are in the QMB program. The whole point of this program is that they don't have to pay those gaps in their care. But sometimes it does happen where a provider will bill the recipient directly rather than Medicaid. They have no obligation to pay those though. And so when they're wrongly billed, what we suggest is to contact us immediately. We can normally work these things out by contacting the provider and having them rebill Medicaid properly. But in any event, there's a legal protection for QMB recipients not to be receiving these bills or having to pay for these things. So if you know somebody or you have a client who this is happening to, you're more than welcome to contact us. We're going to skip this one. This is more confusing than helpful. But maybe if we have extra time, or if you guys see this when you're reviewing the slide decks and think, oh, this really applies to me, then also please feel free to reach out. This is a really unique thing that doesn't come up very often. And then how to apply for Medicare savings programs. This is kind of interesting. I always kind of intuitively thought you would do this through the healthcare authority, but you don't. You apply through DSHS, and so you can do that through visiting your local community service office. You can do it online by following this link here. And there's also a paper form, and you can call the healthcare authority at the number listed here to request the application be mailed to you. Personally, I think it's easier if you can do it online, but that's an option as well. Okay, we're going to pause one more time for questions.
So we are actually doing pretty good on time, and we don't have any additional questions for this section. So I wonder, we probably can maybe stop for questions one more time at the very end in case people were saving it for the end. We do have one question that just came in. Let me take a look. Oh, actually, no, it's just an additional response to a question about the lottery green card program. So yes, we can move forward, but if that's okay with you, Tanner, to just do one more stop for questions at the very end. Yeah.
Okay, and I'm actually taking back over for the last few slides here. Some common issues and how to avoid them. So benefits are often denied or terminated due to income or resource issues, failure to report them, or failure to complete renewal paperwork. We also see that pretty often if someone doesn't keep an address or is unhoused and is unable to keep a steady address and does not get the renewal paperwork. It's a pretty common issue. And so even if a person has coverage, other issues are that procedures or prescriptions can be denied. This may be because the doctor is prescribed a brand name and not a generic, or they're prescribing something off-label, which is when it's prescribed for something other than what the FDA has approved. And there's also a time restriction on how often certain services can be received. We see this a lot with dental. There's only a certain number of cleanings per year a person is eligible for. Okay, so what if something goes wrong? Request a hearing. A lot of times I think clients and providers are a little bit intimidated by requesting a hearing. They think of it as a very serious, formal thing. Honestly, it's very easy to withdraw a hearing, and requesting a hearing in a timely manner can protect your right to appealing and getting your benefits back if you're inappropriately terminated or denied. So we usually recommend erring on the side of requesting a hearing. And how do you do that? You can call or write to DSHS, HCA, or OAH. If you're going to call, I suggest OAH because the hold time is generally a lot less than that at DSHS. Certain types of hearings can also be requested online. This is fairly new, so not for Magi Medicaid. If you click on the link that we have in the slides, it will take you to the online hearing request page, and there it details which hearings you can and cannot request online. And here's also the contact numbers for DSHS, HCA, and OAH. And going back to what I said before, you only have 90 days to request a hearing from the adverse action, which is generally the date on the letter that the client receives saying their benefits are denied or terminated or changed. If they try to request a hearing outside that 90 days, it's often very difficult for the attorney to help them do anything. So really important to request a hearing within 90 days. And then for continued coverage, a client wants to request within 10 days. And what this means is if they get a denial notice or a termination and they request a hearing within 10 days, they can say, I don't think this decision was right, and I still want to stay on my benefits until we have the hearing. And so you only get 10 days to do this. And often we see that mail from DSHS is a little bit late with USPS delivery time. So there really only may be a few days after the receipt of a letter to do this. So important to do it right away for continued benefits. And if you have any questions about any DSHS benefit, not just the Medicaid that we talked about today, but about cash, food, or childcare benefits at DSHS, you can always feel free to email us at the email below, and we'll be happy to help you out or have an attorney provide an answer to your question. And lastly, how do you refer clients to us? There's two ways. So you can refer them to the intake line. Either they can call or their advocate can call. You can call for them, or you or they can also email us. And I do want to point out, because I know many of you are working with the unhoused population, and it can be really difficult to stay in touch with clients. I used to be a housing case manager, so I know how tough that can be when people don't have a phone, a stable address, and you don't know when you're going to see them. So you can do a lot of this on their behalf. Obviously, the attorneys will need to actually speak to the client. We need them to sign paperwork. But if they sign a release, we can do a lot of this through and with you in terms of trying to help them with DSHS benefits. So I just want to point that out. We really want to meet people where they are and reach people who have significant barriers to obtaining these services. So you can call or email. I am the one who coordinates our intakes, so you would be reaching out to me. So definitely feel free. And if you're not sure it's something we can help with, reach out anyway. We can at least try to refer you to the appropriate organization if it's not something we can help with. And with that, I think we're done. And I don't know if we're going to do more Q&A. I think that's what we decided before we turn it back over to Kevin.
Yeah, let's take a minute to do some final questions. And so a good opportunity for everyone here in the audience, if you had a question and you weren't sure if you were going to ask it at the end, this is the time if you want to go ahead and put it in the chat. I do want to just, I think we should end on this referral slide, but Janelle, if you want to go back a couple to the what to do if something goes wrong slide, just reiterating to folks that requesting a hearing, again, sounds like a big deal. Going to court sounds like a huge deal, but this really is the process for addressing any sort of issues. And like Janelle had mentioned, you can drop your request for a hearing. It doesn't count against you. So just knowing that if you're advocating for someone with this is really the avenue to pursue. And so whether you can jot this info down, we'll have the slides for you. And of course, this recording afterwards. And then, yes, let's open things up for questions. We have one more question from the chat, and it has been addressed, but if there's an adverse benefits decision, is there a WAC or a federal CFR meaning something in a law that requires that a notice be given in writing. And so Tanner, thank you, has put a link into the chat to address that question. So if that's relevant for anyone, go ahead and check back in the chat. One more, and it might be a follow-up. Is there an advocacy practice manual or resource published for legal aid organizations helping claimants with Medicaid benefits hearings? Great question. And I think, I think Monty, most folks would want to make a referral in that situation or reach out for some help. But if you're in a position to be providing that legal aid, or I'm not sure if you're asking for a legal aid organization. But anyway, that is the question. If Janelle or Tanner have anything for that right now.
There's not one that I know of. That would be an amazing resource for everyone, including myself. But I'm not familiar with a practice manual or anything like that. I'm not sure if Patty has any insight, if you're in the audience here. But I'm not aware of anything like that.
I think Patty is addressing a lot of these questions and just added some more to that to the first one about the WAC or the CFR, in addition to Tanner's link. So Monty, we might get some more information added, but sounds like that would be a fantastic resource. Again, if it is, like the final slide shows, if it's potentially a referral, something that can be brought up in an intake, please reach out to Solid Ground Benefits Legal Assistance. Okay. And so with that, we can still take questions in the chat. Please send them in here, but thank you all for sticking around. Like I had mentioned, I know we had a number of people join us once things got started. But like I had mentioned earlier, we wanted to take a moment as we are all here together as a coalition of organizations and really ground us in what's going on right now and with the threats to these benefits and really the threats to the safety and livelihoods of the people we all serve. And so I'm very happy to introduce Hallie Willis, our community policy manager, to guide us in some collective advocacy and action. Hallie, if you're ready.
Good morning, everyone. You will very rarely be in a meeting with me where I don't invite you to do something. So, hi, I'm Hallie Willis. I use she, her pronouns. I'm the coalition's policy manager. I help lead a lot of our public policy and advocacy work here at the coalition. And if you're like, what are we doing? I came here for a training. I came here to learn how to connect my clients with Medicaid. Yes, you are. And you did that. And that's great and so important. And that also places you in a really sort of special position to do advocacy, because you know best the way that this system works and the really both the important and essential benefits that your clients need, and how when people can access those benefits, how it can really change their life. And also, how hard it is to get people connected to those benefits. So that sort of gives you a really special set of expertise to be able to lift that up to your elected officials. So if you've been following the federal government even a little bit, you may know that there are some attempts through the budget reconciliation process to make sweeping cuts to Medicaid, SNAP, and many other programs that people with low incomes need to meet their basic needs. This could be really bad. The bill as it stands could affect Washington by reducing coverage for 1 in 4 people who use Medicaid. Like, they could lose their coverage. That is completely unacceptable. That's about 500,000 people in Washington state who could lose coverage. And that's, including, of course, extremely low income people who have no other options for healthcare. Um, So we need to stop that from happening. And the way that we do that is by speaking up together. So I have there's 52 of us here on this call. So if we each send a letter this morning, that's 52 letters going to our different members of Congress. I'm going to drop a couple links in the chat. The first one is specifically about Medicaid. And so this is a really quick and easy action. You just like pop in your information and hit send. If you have time and if the site allows you, everybody's site is a little bit different. Um, you you should take the time to personalize the letter a little bit, especially because you all are in this really unique position of being, experts on Medicaid and what it takes to get people connected and what it means to them. So if you're able to and you have time, please do personalize it. It really does matter. But if that's the thing that's getting in between you and sending the letter, if you're like, I don't know what to say, or like, I don't have time to personalize it, just send it. Like, sending it is the most important thing. And if you have time to personalize it, that is an extra special bonus. Okay, so that's the first one. The second one that I'm going to share with you is more focused on SNAP, which is also on the chopping block. So I would strongly encourage you to take both of these actions this morning and send a letter to your elected representatives. And go ahead and maybe give us an emoji either like in the chat or in the little like Zoom reactions thing when you're done taking action. Because if we all do it, that's like over 50 letters that are going out to your various members of Congress. And that is like so important now. Even if your members of Congress are already supportive or sympathetic, it's still really important to reach out to them so that they can then go to their colleagues and say, I had 100,000 people send me an email about this. Like you need, and so they can use that as ammunition basically to convince their colleagues. That's a question that I get a lot is like, well, like, my representative is Pramila Jayapal and she already is super on board with this. Like, why should I bother her? Still bother her. Also, you won't bother her. It's good. This is how democracy works. So go ahead, do take those actions. It is super important. If you're not on our action alert mailing list, or if you're not sure, I'll drop that link in the chat. That's the best way to stay in touch with us to get action alerts for every level of government. And it's basically my entire job to make it really easy for people to take action. So if you want me to spoon feed you beautiful little moments to to take action here and there, do hop on that mailing list and I'll put that link in the chat. And that's all I got, y'all. I'm happy to attempt to answer any questions with the caveat that I'm not an expert on the federal government. I'm like much more comfy in my like local government universe, but happy to attempt to answer any questions if folks have them.
Yeah, thank you, Hallie, for offering that. Yes, again, we're all here in really in community and in coalition, and we have many of, as diverse as our audience is, we have one thing in common in that we are very much advocates for the safety and livelihoods of the folks we support. And so this is a scary time, and I think it's okay if you don't know if you have any questions, but if you do, you can feel free to kind of ask that out, and as a drawing from all of our expertise as a hive mind, we can try to answer any of those. But as Hallie mentioned, these are designed to kind of be, not be too time consuming. We know that you're busy. We know that you really don't have a lot of energy for this, but at the same time, it is so directly impactful. And again, it's not always worked into the work. So if you want to click the links, open them up in your browser, bookmark them, and get to it a little, maybe not bookmark because we know that can lead to not seeing that, but keep that window or tab open and get to it later in the day, please do so. The timing, really does matter. This is, of the moment, and timing is of the essence. So,
Oh,
um,
yeah, Kevin, that's a great point. I didn't even explain that this vote is happening this week. Like it could be this afternoon. This vote is happening really, really, really soon. So this is really important for folks to take action as soon as you can and share it with your friends. All of our action alerts are like forwardable, um, and they'll all take 5 minutes or less. Like nothing that I send you will take more than 5 minutes to do, unless I'm like inviting you to come to City Hall with me. Then that will take a while. But all of these kinds of things are super, super quick and easy. Definitely do please share it with your colleagues and your neighbors and people that you know that live in different parts of the state, or even in this case, different parts of the country. It's really important for folks to hear from them.
yeah, I can't reiterate that enough. Thank you so much, Hallie. Right there, I'll almost go as far as to say it's designed so they don't hear from you as often as they probably should. And you are all the folks that they really need to hear from. And so if you have a moment to personalize that letter, great. But also just sending it forward really does make a difference. As Hallie mentioned, you can sign up for our email list if you want to get more action alerts. And then of course in the chat are those two links to send those letters and support extremely vital, life-saving public benefits that we already know aren't enough, and um, don't even want to think about the prospect, the possibility of losing them, which is right on our doorstep. So with that, thank you all so much. If you are interested in finding out more information from benefits legal assistance. Oh, actually, there's something in the chat from Patty right now. If you're a lot of interest in the chat throughout this training on immigrant and refugee benefits, please reach out to Patricia B at solid-ground.org. And yes, thank you all so much for joining us today. As you know, we do a number of these trainings throughout the year, part of the Public Benefits Are Key series. This is likely going to be our last Medicare Medicaid training of the year. So for your colleagues and coworkers, if something comes up, you have questions, please refer them to our recording of this training on the Coalition on Homelessness YouTube page. And then also please be in touch with benefits legal assistance as as new information comes up and as you might need that intake line and explore a referral. So I see a lot of thank yous in the chat. Thank you all so much. Thank you to our presenters, Tanner Yamada, Janelle Stark, and of course, Patricia Bowen, who is in the chat from Benefits Legal Assistance, answering those questions. Thank you to Danielle Palmer Friedman, our communications lead, for supporting this training. And then, of course, Hallie Willis, our community policy manager, for joining us for this collective action. All right, everyone. We will be in touch soon, and we hope to see you at the next training and at our next community meetings. Thank you all.